Hello, this is Charles Blair. I want to give you a few tips on implant coding. First of all, we do want to code out an implant crown, not a natural tooth crown. That would be fraudulent if we're intentionally trying to do that. So always code and report what you do. Now the error that I see on implant crowns is that we generically call them implant crowns, but from a coding perspective there's two broad types. There's the abutment supported crown and the implant supported crown. The most common type is the abutment supported type system. This is where we have the implant, and the implant is coded 6010, and then the abutment sits on top of the implant. Now the abutment, there's two types, code 6056 and code DO 6057. The 6057 is a custom abutment. The D6056 is the prefab abutment. So we have the implant, then we have the abutment, and then the crown goes on top. Now here's where we see the error. We want to be sure that we're using the abutment supported type crowns. The most common codes you would use would be 6058 for the ceramic crown, 6059 for the porcelain fused to high noble. The mistake that's made is using the 6065, 6066, 6067. These are three types of crowns: ceramic, high noble, metal. Those are for the implant crowns, and that's where the implant crown screws directly into the implant. And so the crown goes straight into the implant. It's all one piece. We call that an implant supported crown. So be sure you do code out, folks, the abutment separately from the crown. That's a takeaway for you. Also, if you do place or you do use an implant index, or if the GP makes that for the oral surgeon, the code for that is code 6190. That's a relatively new code. One other pearl is, what if the specialist gives the GP the abutment and the GP puts the abutment in the mouth? The code itself, 6056, is the code used by the person who actually puts it in the mouth. So the GP would use code 6056. The GP, all things being equal, should charge less money because it has been given to the GP by the specialist. The specialist, on the other hand, cannot code out code 6056. The specialist could put down a 6199 code, which is an unspecified code, and then indicate that the abutment is furnished for the GP.